In February 2024, a huge part of the American healthcare system simply stopped working. Pharmacies couldn't confirm insurance. Hospitals couldn't get paid. Patients stood at the counter, unable to fill prescriptions they needed that day. And it all traced back to one company most people have never heard of, and a single stolen login with no second lock behind it. The company paid an estimated $22 million in ransom. And here's the twist. They paid and got almost nothing for it. This is the story of the hack that froze much of America's healthcare payments and became the largest healthcare data breach in U.S. history. To understand this, you have to understand Change Healthcare. You've probably never seen the name, and yet it has very likely touched your life. Change Healthcare is part of United Health Group, and it runs the invisible plumbing of American medicine. When a pharmacy checks your insurance, when a claim moves from a clinic to an insurer, when a payment flows back, a huge share of that runs through this one company. It reportedly touches around 1 in 3 patient records in the United States and processes billions of healthcare transactions a year. It is not a hospital. It is the wiring between all of them. And in February 2024, that wiring went dark. The attack came from an affiliate of a ransomware group known as BlackCat, or ALPHV. They didn't need a Hollywood-style break-in. Reportedly, they used a stolen login for a remote access portal, a portal that critically had no two-factor authentication behind it. One set of borrowed credentials, and they were inside one of the most sensitive networks in the country. And then they were patient. For around 9 days, they quietly moved through the network and copied enormous amounts of data before they ever triggered the ransomware. By the time anyone saw the encryption, the damage, the theft, was already done. When Change Healthcare pulled its systems offline to contain the attack, the effect rippled across the entire country almost instantly. The electronic pipes that carry payments and claims went silent. Pharmacies couldn't always verify coverage and switched to cash or to slow manual workarounds. Small medical practices, the ones without huge cash reserves, suddenly stopped getting paid for the work they were doing, and some were pushed to the brink within weeks. Patients were caught in the middle, paying out of pocket or going without. For a company that touches around a third of the country's patient records, even a short outage isn't an inconvenience. It becomes something closer to a national emergency, playing out one pharmacy counter at a time. And this outage lasted not hours, but weeks. And this is exactly why healthcare has become a favorite target. Medical systems hold the most sensitive data there is, and they cannot simply switch off and wait. Care, and sometimes lives, depend on them staying open. That combination, deep pockets, irreplaceable data, and almost no tolerance for downtime, is precisely what a ransomware business hunts for. To these groups, a healthcare network isn't just a victim, it's close to the perfect victim, one that almost has to pay. And notice who actually carries the cost. Not the criminals, who are usually far out of reach, rarely even the executives. It lands on the patient who can't fill a prescription that morning, and on the small clinic owner watching the bank balance drain while the work piles up. The breach happens in a server room nobody sees, but the bill is paid at the counter by people who never had a say. So Change Healthcare's parent company did what the attackers wanted. It paid. The chief executive later confirmed the company had paid a ransom of roughly $22 million, hoping to protect the stolen patient data from being leaked. And this is where the story turns dark in a way most ransom stories don't. According to reporting, the BlackCat group took the payment and then essentially vanished, reportedly cheating its own affiliate out of the cut and shutting down. The data was never safely returned. Worse, the company then faced further extortion attempts over the same stolen files. They paid $22 million and bought almost nothing. No clean recovery, no guarantee, no safety. Just proof that paying criminals is a promise written in smoke. And the data itself was the real catastrophe. At first, the breach was estimated at around 100 million people. As the analysis continued, that number climbed to roughly 190 million. That is more than half the population of the United States, and it made this the largest healthcare data breach the country has ever recorded. The stolen files reportedly included names, addresses, social security numbers, dates of birth, and deeply private medical information, diagnoses, treatments, test results. This is not the kind of data you can change, like a password. Your medical history is yours for life. Once it's out forever. The financial bill was just as staggering. The response, rebuilding systems, supporting providers, handling the fallout, reportedly cost the parent company an estimated $2.87 billion in a single year. Billions of dollars, roughly 190 million people affected, and a healthcare system thrown into weeks of chaos. And the root cause, underneath all of it, was almost insultingly small. One remote portal into a company that touches a third of American healthcare that was never given a second lock. No two-factor authentication on the door to the most sensitive plumbing in the country. So here is the entry in the ledger. On one side, a single stolen login on one portal, missing the one setting that a free app on your phone can provide. On the other side, much of U.S. healthcare's payment system frozen for weeks, around 190 million people's most private records stolen, an estimated $2.87 billion in response costs, and a $22 million ransom that bought nothing at all. That is the exchange rate when the plumbing of an entire industry is guarded by a single, unguarded door. Every hack has a price tag. This one was paid by patients at the pharmacy counter, by small clinics fighting to survive, and by a huge share of the country, whether they ever knew it or not. The channel is the breach ledger. We read the receipts so your company never has to pay one. Put the second lock on the doors that matter most. And I'll see you in the next case.